Hi, my topic is Natriuretic Peptide Analogue Therapy in Children with Achondroplasia by Jocelyn Castillo. First, definition. Achondroplasia is a form of short-limb warface. The word achondroplasia literally means without cartilage formation. Cartilage is a taut but flexible tissue that makes up much of the skeleton during early development. However, in achondroplasia, the problem is not in forming cartilage, but in converting into bones. It's a process called ossification, particularly in the long bones of the arms and legs.
Achondroplasia. What is achondroplasia? A means without, chondro refers to cartilage, and plasia means growth. So this is basically impaired cartilage growth or proliferation. This is a common cause of dwarfism, and as you may notice from this picture, these individuals have a normal head and a normal trunk. And the reason that this occurs is, if you may recall from embryology, there are two types of bone formation. Intramembranous bone formation, this is not affected. However, you may notice in these individuals that their extremities are shorter. They're not developed properly. This is due to impaired endochondral cartilage bone formation. These individuals have an activating mutation on the fibroblast growth factor receptor 3. So the FGFR3 is increased in expression, so you have too much of this receptor on the cell surface, and what your body does is it responds by saying, hey, you're giving too much of a growth signal, so they're going to inhibit growth. So growth is going to be inhibited. Achondroplasia tends to be sporadic. It has an autosomal dominant inheritance pattern. Fertility, lifespan, and mental function are not affected in these individuals. So they have normal fertility, lifespan, and mental function. The incidence of achondroplasia increases with increased paternal age. So looking at this x-ray, we notice that the long bones have not developed properly. And the reason that these long bones don't develop properly is because the main mechanisms that long bones grow is due to endochondral bone formation. In summary, achondroplasia refers to impaired cartilage proliferation that inhibits growth plate and long bone formation, and these individuals end up with short extremities. However, their head and trunk are normal. And the mutation is an overexpression of FGFR receptor 3. It is an overexpression of FGFR3 that leads to inhibition of growth.
Application in nursing. The hallmark clinical features are short stature with rhizomeric limb shortening and macrocephaly. Medical complications include hydrocephalus, hypotonia, back and leg pain, conductive hearing loss, and speech delay. Relative tonsillar hypertrophy may result in obstructed sleep and respiratory insufficiency. Foramen magnum stenosis and cervicomedullary compression may result in central apnea, leading to increased risk of sudden death in infancy.
Yeah, DA46 is a protein trap or a decoy, which basically works by trapping the natural ligand of the FGFR3 receptor. By doing so, it reduces the activity or modulates down the activity of the FGFR3 receptor, which we know to be overactive in achondroplasia. So our real goal here is to modulate FGFR3 signaling to a normal level and therefore restore the bone growth as it is in people that don't have achondroplasia. And we plan to do that by using TA46, which is a protein designed to be administered once a week subcutaneously, that reaches into the growth plates, blocks the signaling or reduces the signaling to the FGFR3 receptor, and we plan to do that as early as after birth.
Next, pros and cons. Pros. Blood pressure and pulse rate were monitored frequently after the initial dose was administered. All reduction in blood pressure from test to test we report to non-serious and transient and resolved without medical intervention. No result in interruption of discontinuation of the study drug regimen. Cons. During the treatment periods in the dose-finding and extension study, serious adverse events occurred in 4 of 35 patients, 11%, and include grade 3 obstructive sleep, grade 1 tonsillar hypertrophy, grade 3 thyroid losal, and grade 3 screens. Issue apply in Ecuador. In Ecuador existe Asociación Ecuatoriana de Personas de Baja Talla. This association urges young people with what fears together to share life experience and help each other. In Ecuador, there are few data of this condition as the prevalence is quite low. Finally, in conclusion, in children with achondroplasia, daily subcutaneous administration of vasoretide was associated with a side effect profile that appeared generally mild. Treatment resulted in a sustained increase in the annualized growth velocity for up to 42 months. Thank you.